afternoon to our viewers who are non-Arabic speakers, and welcome to this almost weekly press conference. I will start with the numbers, and I hope these numbers will indicate or will tell us all how serious this matter is. Worldwide, there are more than 32 million cases, reported positive cases of COVID-19 disease. The death rate worldwide, or the number of deaths, almost 1 million. It's very sad to see video clips and messages from people who claim that they are healthcare professionals, or some of them maybe politicians, denying the presence of this disease and still believing in the conspiracy theory. The disease is real, it is spreading, it is killing people everywhere. In Oman, yesterday, there were 568 cases, which takes the total number of cases in Oman to 95,907, and that's a very huge number for us. Those who passed away, in total, 885. Yesterday, 10 deaths. We admitted in all our healthcare facilities 62 patients yesterday. The total admission is 512. Of the 62 cases, 9 cases in intensive care units, which takes the number to 185 patients of COVID-19 in our intensive care units. We reached a record about a week ago of over 190 cases. That's very much beyond our capacity and exceeded all our expectation. Those who recovered are 86,765, which is about 91% of the cases. A couple of weeks ago, the percentage of those who recovered was 94%. The number dropped not because people are not recovering, but because the number of those who are affected is exceeding those who are recovering. Those who are in quarantine, home quarantine, 36,734 person, and in institution quarantine, 203. We appreciate and we understand that all of us are tired, frustrated, and bored with COVID-19. But what can we do? Worldwide, as I said, the disease is spreading very fast. The death rate in Oman is 1%, which is lower than the international average, but any death is devastating. And when we talk about numbers, please remember that there are persons behind these numbers. We lost a nurse 10 days ago. She died. She was one of our intensive care unit nurses. She's only 37 years old lady. She has family, she has friends, she has relatives, beloved ones. We're extremely, I would say, frustrated, that's not enough, but worried and saddened also that after we've reached the peak, the first week or second week of July, and the cases started to come down, suddenly over the last 3 weeks, cases gone up again. And we know the reasons, we know why. Unfortunately, I would not say many, but there are the few who are not implementing or taking the healthy precautions. I always repeat this is the most powerful weapon we have now against COVID-19. If you wear it properly and appropriately in the right places, it is as good as the vaccine, or even better. But unfortunately, we know that people are gathering on the beaches, in farms, those places, having parties, weddings, funerals, no mask, no physical distance. And the end result? The number of cases going up. And the blame on the government. No, the government did all what they have to do. It's us, all of us. We need to feel the responsibility. And we need to work together. We are in this disaster together. None of us is safe until all of us are safe. And not a single country also will be safe until all of us are safe. Because of the increasing number of cases, probably you've noted this week that His Excellency, the chairman of the Supreme Committee, and some members of the Supreme Committee, we visited the field hospital, which we hope will be functional, stage 1 for 100 bed within a week to 10 days. And then the capacity should increase to about 312 beds. And there's also quarantine capacity if we need to. But we were hoping not to require this. Unfortunately, what's happening is the opposite of what we hoped. We know that we've opened shops, activities, but the economy has also, we cannot live without finance, without economy. We have to open the country, but we have to learn how to live with this virus. We can protect ourselves from it if we do the simple things that we all know. I heard horrific stories. Is a person who sent a message to one of my colleagues, 6 of his relatives, six, died over the last few weeks from corona. Most of these deaths probably are avoidable. We've reached the capacity in our ICU, as I said. We are expanding as much as we can and as fast as we can. But better than that, let us prevent this disease. Let us do the right thing. I don't think any of us can live with their conscience knowing that they spread the disease to somebody who would end up in the intensive care unit or, God forbid, dead. We also know the Supreme Committee get many messages that in shopping malls, supermarkets, offices, whether government or private sector, unfortunately, there are people who are not applying or following the rules. And I urge all of you to report them, advise them initially, remind them it's their health, their beloved one health. And if they don't listen, please contact Royal Oman Police. It's very sad when we see people dying unnecessarily. We've seen examples of countries which did very well to manage the first wave of the pandemic. But because people unfortunately relax too much, opening places where there's gathering, and again I'll remind you with the 3 C's that we have to avoid. Closed places, crowded places, close contact without a mask. We've seen in many European countries and elsewhere that the second wave is becoming more severe actually, the numbers are more. And we don't need to remind ourselves of what happened in 1918, the Spanish flu, when 50 people lost their life to it. And most deaths happen in the second wave. Many questions in Arabic were, are we in the second wave? We've never left the first wave to go to the second. We just slipped through the second, unfortunately, because also many of us are not doing what we can do to prevent it. You've heard lots of stories probably and news about the vaccine, and I can assure all of you that we are working with all parties, including WHO, to obtain the vaccines after they are licensed and proven to be effective and safe. As yet, up till now, there is not a single vaccine licensed worldwide at all. But I'm glad to say that there are at least 9 companies in the final stages of what we call phase 3 clinical trials, which means just if all goes well before the licensing. And there are more than 200 other companies who are in the pipeline. But again, before the vaccine, before the treatment, prevention, prevention, prevention. We have to learn how to live with this virus at the moment. It has to become part of our life, unfortunately, our daily routine. I never thought, and none of us would have thought, going everywhere wearing a mask, keeping your physical distance from your beloved one, from your friends, which is against human nature. But this virus, it loves nothing more than us getting very close to each other, one of us having the virus, and he or she can spread. I wish you all well, and I urge all of you to continue, please, taking precautions, to follow what healthy lifestyle that you know to prevent this virus from spreading to your family, your community, and our country and worldwide. Thank you very much again.